Hi, this is Dr. Matt Lawless from MSM Products and Knee Fit in 5 bringing you another knee moment. Today we have a question from Chris in Tulsa. He asks, when do I need to see a doctor for my knee pain? And that's a great question. I get that asked very frequently. When is knee pain so bad that I need to see a physician? My answer to that would be anytime you are uncomfortable and you're concerned about your knee is a very reasonable time to see a knee doctor, a orthopedic surgeon, your primary care doctor, or whoever. Do you need to go see them right away? No. As we made Knee Fit in 5, a lot of times you can even circumvent going to the doctor by doing some therapy and doing some exercises. A lot of people with knee pain start favoring their knee. They start limping. They start using it abnormally. And so their knee pain, as their knee gets weaker from favoring it, becomes more exacerbated. And they start developing other kinds of knee pain. So the first thing I would recommend doing, whether or not you see your knee surgeon, would be to start on some physical therapy. And the first thing I would start on is getting your extension back, getting your flexion, and then getting your strength back. If you're walking with a limp, get rid of your limp or try to get rid of your limp. I guess back to answer the question, when to see a knee surgeon, whenever you're in question, whenever you feel like you need to. There's nothing you will do, however, that will injure your knee. There's almost no case where working on range of motion, working on getting your muscle control back and walking normally will hurt anything in your knee. The only caveat to that would be if it was something rare like a fracture or something. But in almost all cases, working on some initial physical therapy might be enough to alleviate your knee pain and avoid a visit to the doctor. I hope that helps. Thanks.